I'm Geert Molenberghs, Professor of Biostatistics here at KU Leuven within our Department of Primary Care and Public Health. I'm also a professor at the University of Hasselt because the two universities share an institute for biostatistics. The research group I belong to here within our department and our faculty is LStat, which stands for the Leuven Center for Biostatistics and Statistical Bioinformatics. It's the counterpart to the Hasselt component, which is the Center for Statistics there. So we belong to the department and collaborate with various groups within the department. We also have connections outside. That means, of course, with various groups within the faculty, within the group of biomedical sciences, and definitely also within the academic hospital. Further, we are a group of statisticians and data scientists. We're not the only one at KU Leuven, because altogether there are about 10 groups spread over all faculties and all groups within the university. And there is a, let's call it, a federal umbrella over all of the statisticians within Leuven, the Leuven Statistics Research Center, which is also responsible for the Master of Statistics and Data Science, within which many of us teach quite a bit. The research we do is, on the one hand, methodological, like we develop new statistical methods, ways to analyze data, hypothesis tests, etc. Some of it is relatively theoretical. On the other hand, a lot of our research, and I think that is the main approach that we follow, is driven by very practical, concrete research questions raised by people, colleagues within the biomedical sciences group. A clinical study they are going to set up, or one that has been conducted and they would like to have analyzed. For example, also epidemiological studies, registries where certain issues arise. What are we going to do in the context of rare diseases where we have great needs but not so much data, etc. So a lot of our research is really inspired by the problems that occur in everyday clinical science. The pleasure of doing biostatistics is, on the one hand, people like us who like mathematics, also methodology can contribute in that way. But also what we do at the end of the day can benefit public health, can benefit clinical sciences, the development of new medication, new interventions, etc. The adequate development of new vaccines is, of course, another example. I think of the COVID pandemic, for example. So the fact that we can contribute to the well-being of the population and the patient, I think, is the most important driver for our research. The importance of our research, I think, can be summarized by more efficient, more adequate, more trustworthy development of new medications, of new therapies, new interventions, etc. in such a way that, for example, in a clinical trial, less patients are needed, the patient burden can be minimized. For example, we do a lot of research around what we call surrogate endpoints, that is replacing an endpoint in a study that is invasive, uncomfortable for the patient, for which a lot of travel to the center is needed. If that can be replaced by something that is much more convenient for the patient, yet gives us all the information we need, then we have contributed, I think, in relevant ways, again, to the well-being of the general population. Quite a bit of the research we do at this point has to do with rare diseases. We are involved as a team in several European projects in that regard, where we collaborate with people from all over Europe and actually also beyond. Not only other academic centers, but also people working in industry, the regulators, for example, the European Medicines Agency, the United counterpart of Food and Drug Administration, to make certain that in a context where there are very acute needs, because in a given rare disease, there are by definition not so many patients, but there are many rare diseases, so that the European population as a whole actually suffers quite a bit from rare diseases as well. These are projects where we contribute methodology in order to move to therapy, treatment, in some cases prevention, faster than scoring indicates.